Okay. So, as you know, the administration just passed a new big, beautiful bill. Okay. And from what I can tell, there are so many families, especially families who have children or people in their families with disabilities, who are very concerned about how that will affect them, especially those families who have Medicaid. So if you don't know, Medicaid is typically for designed for low income families, but for people who have disabilities, Medicaid is also designed to cover or assist people with disabilities, old, young, children with disabilities. Medicaid has a sector in which the government will assist and give special services to people and children with disabilities through the Medicaid system. So when my son was diagnosed with autism at age 5, he was classified as an individual with disabilities. And so he qualified for Medicaid because he had this. We didn't qualify for Medicaid as a family. We always were above the income limits, but because he had a disability, he qualified for his own insurance through Medicaid, if that makes any sense. Okay? We already had insurance. We already had insurance. We've always had insurance. But because he had a disability at the time and he's always been disabled, he qualified for disability Medicaid. Okay. So right now, families are discouraged, they're scared, they're worried, they're confused about what this big, beautiful bill is going to mean for their children who have autism. And so we're going to talk about it today. Okay. And just so you know, even though my son is 26, he still has autism. He still has Medicaid. He's still covered because he has a disability, and he qualifies for disability Medicaid. Okay, so all of us who have a child with autism need to be aware of what can happen. So that's what we're talking about today. Okay, so we're going to talk about 4 major ways this big beautiful bill affects autism families. Okay, because it's very important that you know what's happening and what this bill means. All right, so the first thing is that there will possibly be, not possibly, it's already started, very deep cuts to Medicaid and CHIP. CHIP is an acronym that means Children's Health Insurance Program. Up to 10 million Americans, including children with autism, risk losing coverage due to tighter work requirements and stricter eligibility checks. Yeah, so that's a live that I'm going to do in the coming weeks as we, go through the month of July. All of my videos this month are going to be related to this big beautiful bill, and I'm going to talk about that in detail, about the work requirements and the more strict eligibility requirements. Basically, to summarize it, the government is going to require that people who qualify for Medicaid will need to work a minimum of 80 hours a month in order to qualify for Medicaid. And that's even for caregivers of children who have a disability. But we're going to get into that. That's a whole nother. Okay. The second thing, the way this bill will affect autism families, you will have reduced access to disability supports. See, this is the reason why a lot of times people who have a child that has autism think, well, I mean, my kid doesn't need Medicaid, you know, medical insurance, because we already have medical insurance. But Medicaid disability will give them access and support that your regular employer funded healthcare will not cover, or it'll cover very minimal. You'll have a lot of out of pocket expenses, and disability Medicaid will cover a lot of therapy and all the things, many of the things that your child may need with an autism diagnosis. So there will be cuts in non-mandatory funding for long-term and community-based services that threaten essential supports like respite care and in-home assistance. So just because we say in-home assistance, we're not talking about like a nanny that comes to the house. I mean, in-home assistance could be an occupational therapist that shows up to your child's home once or twice a week because you homeschool your child. You know what I mean? Or some kind of, therapy sessions or ABA therapy that comes to your house. Yeah. Disability advocates warn this will disproportionately harm children seeking regular therapy and developmental support. Yeah. And we say disproportionately because wealthy families who can pay out of pocket for these services have the ability to do that. And it's not a low income thing. I mean, even the middle class, therapy sessions could be, I don't know, upwards of $500 a week. That puts a strain on anybody. You know what I mean? I mean, unless you're a gazillionaire, I mean, you're looking at these services like, well, wait a minute. You know what I mean? We don't have just an extra $2,000 a month laying around just for support services, developmental support. You know what I mean? Where the Medicaid services were covering that. You see what I'm saying? And your regular employer funded health services don't cover that. Thirdly, this bill will cause a strain on rural health and education infrastructure. Rural schools that build Medicaid for special education services face budget cuts and shortfalls, potentially leading to reduced speech and OT hours, occupational therapy hours. So, for instance, if you've watched my past videos, you'll know that my son, whenever he was in elementary school, he went to a special needs private school that the district funded through his Medicaid. Okay? So because he had Medicaid, he qualified to go to this school that the district funded. But because he had Medicaid, the occupational therapists, the speech therapists, all the therapists, it was considered an outpatient. Wait, how do they say it? A partial hospitalization program. So he wasn't inpatient. It was like a partial hospitalization program because he had access to all of these professionals, medical professionals at school during the school day, Monday through Friday. Okay. And it was incorporated into his IEP, and his Medicaid covered it. But these special education services will face budget cuts. So this may take these professionals outside of the schools. Okay, these school-based therapies, speech, O2, behavioral support, etc., that are funded through Medicaid reimbursements may shrink or disappear. Schools rely on this funding from Medicaid in order to provide these professionals for children. And without the funding, also, hospital and clinic closures due to funding cuts further restrict local therapy, early detection, and specialist access. Yeah. So I feel like we've already started seeing the changes. In the groups that I'm in, what's happening is there are parents in these autism groups who have children who have autism characteristics. And they're like, I know my child has autism, but they're not diagnosed yet. We're on a waiting list to be diagnosed. Okay? And if they're not diagnosed, they can't get services, not without an official diagnosis. Then the people who do get diagnosed, they come to the group and they say, hey, my child just got diagnosed last week. I have this paper, what do I do? Or they'll say, I took the paper to the school district, but the school district, I saw this, I saw a post. This isn't even in my notes. It just popped into my head. I saw a post over the weekend, and a parent took their child. How did this happen? The parent took their child. They had a diagnosis. The parent took their child. I wonder if I screenshotted it. So I think wait a minute. I think I screenshotted it so that I could read it to you. Oh, I did. Look, okay, so here. I don't want to read it verbatim because it's like kind of anonymous. You know what? It was an anonymous post. I'm going to read it to you anyway. This child, I'll try to summarize it because it's kind of long. This child was diagnosed with level 2 autism. Okay? ADHD, extremely hyper, can't focus, nonverbal, all the things, right? And they took their child. Oh, and also, this child has epilepsy. And they took their child to the Social Security department, and the lady said, your son doesn't have autism and your son doesn't have epilepsy. And meanwhile, the woman, this child was diagnosed like over a year ago. And he was diagnosed, and he wasn't young. He was like 7. And the lady started crying. She was like, what do you mean? I have this documentation. I have a note from the doctor. I have a note from the school. My son needs SSI. And the lady said, you're not going down this road. We're closing this case. And there's nothing, we're going to give your appointment to someone else. So what's happening is people are walking in with proof, and these systems, these programs are denying people. So even if they're not saying things like, sorry, we don't have any more availability for your child, they're saying things like, you're on the waiting list. The waiting list is 2 or 3 years long. Some of them are just kind of flat out saying, your child's not severe enough, or we don't believe this. The doctor didn't say what we needed. The doctor's report didn't say what it needed to say in order for us to approve you, so we're denying you services. It's getting crazy out here. This is a result of what's happening. Okay? The bill, the budget cuts. Budget cuts started before this bill. It started at the beginning of the year. It's July. Okay? Yeah. And then fourthly, I touched on it earlier, the new Medicaid work requirements. Adults, even caregiving parents, may be required to work 80 hours a month to maintain Medicare coverage. Parents of children with autism may struggle to meet these requirements, risking loss of benefits just when they need them the most. Let me explain to you why. And again, I'm going to go into this in another, I'm going to break it down. But what's happening is there are so many parents who are single parents who cannot work. And they can't get their child in a program because their child doesn't qualify, or their child hasn't been accepted, or their child's been kicked out. They're too violent, they're too whatever. Okay. And so the parent has to stay home with their child. And so they're receiving Medicaid and SSI payments and maybe food stamps to support their income, to support their household. They're barely scraping by. You know that the groceries out here are going up. The grocery bill's ridiculous, right? And what this bill is saying is that these able-bodied parents need to start working at least 80 hours a month or 20 hours a week. And parents are like, nobody will take care of my child. My child doesn't qualify for the programs. The funding has been cut. It's backing parents up against a wall. That's what's happening. It's kind of a big deal. Okay. I am putting together some information to help parents with this. I'm in the process of doing it. This is what I want you to do. I want you to share this video with whoever you know who has a child with autism and who is scared. If they have it all taken care of, that's fine. This is for the people who are struggling to know what to do next. This is for the people who, we've been trying to get into these programs. And we feel like I'm at my wit's end. Okay? I need them to watch this video. I need them to subscribe to my YouTube. I need them to watch all of my July videos, because I'm going to be breaking down what's happening, what needs to happen, and what parents can do about it. Okay? Because again, my son is also on Medicaid. But if they kick him off of Medicaid, I have a plan. And I'm going to show parents how they can have a plan too. All right? Okay. If you need more information about me, you want to see my bio, my background, my whatever, you can go to my website, TerayWard.com. I'm going to drop the link in the comments. Okay. If you want more information about what to do, questions answered, I have a course on my website. You can take a look at that as well. Subscribe to my YouTube channel. If you have any questions or comments, or there are some topic ideas that you want me to discuss, drop it in the comments. And I'll see you next time. Thanks for watching.